Okay, we're live.
Okay, Shannon, did you want to record this also or just do the live?
I'll record it. Thank you.
Okay, welcome everyone. Our forum tonight is addressing a vulnerable population that is experiencing unique challenges during this COVID-19 crisis, and that is the LGBTQ community. We are so pleased tonight to be able to address this important topic with experts from a variety of fields who have insight and resources for you and your loved ones. Joining us today, Sheena Barnes, the Executive Director from Equality Toledo. Hi, Sheena. We have Nick Comives, Toledo City Council member, Elijah Jones, who is Manager of Treatment Services at the Mental Health and Recovery Services Board of Lucas County, Mary Jay, who is a Disease Intervention Specialist from the Toledo-Lucas County Health Department, Sydney Renner, a social worker from UTMC who works with people living with HIV through the Ryan White program, and Lavelle, who is an advocate for the LGBTQ community and who will provide some insight personally on the issues within that community. So welcome everyone and thank you for being here. We are going to be so happy to take your questions on our Facebook Live tonight for all of these experts. And we're going to start, if you don't mind, with Sheena first. And Sheena, I'm going to ask everyone else to turn their cameras off so we can see our wonderful sign language interpreters tonight for our deaf community. So Sheena, why are the disparities so high in the LGBT community when it comes to COVID-19?
Just like with any marginalized groups, unfortunately, there's lack of resources, accessible resources, whether it's due because of discrimination or just because accessibility is transportation or knowledge. Also, we see when we have marginalized communities like the LGBT community, also is experiences that are negative. So therefore, we don't trust right away. Even if it's the best benefit for us, it's very hard to overcome some of the challenges that we have had in the past and even currently with our healthcare system. And I think those do play in hiding of increasing disparities.
So when we're talking about these healthcare disparities, and maybe I can pull Sydney into this conversation, because Sydney, you work a lot with this community when it comes to getting those health services. What is it that prevents them from either seeking or getting the services that they need under these circumstances?
I think Sheena made a lot of really great points, especially about the mistrust that there is for the traditional healthcare system. A lot of providers have the belief that if they provide services equally across the board, then that means that they're providing services that are equitable. And the difference is that sometimes when we have these marginalized communities like communities of color or people who are LGBT, you have to actually provide specific resources and marketing and training for these groups. Otherwise, you're not truly providing that equitable experience that you think you are. Another thing is knowledge. When we talk about these communities that are marginalized and kind of just, I guess they occur below the surface a little, they're a little bit more hidden communities, getting information out to them can be a little bit more difficult. So you have to be willing to meet people where they are. And so if that means having targeted messaging on Grindr is the way to reach people in the community, then that's what people should be doing and kind of taking their personal beliefs or values out of the situation. Fortunately, the program that I work for, it is a federally grant-funded program, the Ryan White program, and our program, the grant really understands that social determinants of health, things like poverty, homelessness, domestic violence, that kind of stuff, if those needs are still happening, then people can't access healthcare and other resources that they might need, like mental health care, if those other needs aren't met. So we have opportunities to help people with transportation, We have ways to pay for cabs to get people to appointments. We have funds to provide people with gas cards, and we can provide bus tokens. Right now in Toledo, with the bus being free, we don't have to. But normally throughout the year, we understand that if people don't know how that they're going to get to their medical appointment, then it's probably, not the first thing on their mind to solve for the day. So we try to remove some of those barriers and make it a little bit easier for the people that we work with.
What would be your best advice, Sydney, while we're talking about this, for somebody in this community who may need that attention and is currently just not comfortable seeking it? Are there steps that people can take, or what is your best advice on that? Because we don't want people going without being seen and not getting their, health issues looked at.
Yeah. So, the best advice that I have is to ask around. Toledo has a lot of medical systems, and I'm talking physical healthcare, and then even mental health care. We have this vast network of providers. And so, ask your friends, ask your friends in the LGBT community, who do they go to, and, who do they not have to explain what it means to, and, who in the community is kink friendly and poly friendly and just, truly meets people where they are. And people know. We have a joke like in social work or in therapy that if someone identifies you as like a kink positive therapist or an LGBT positive therapist, all of a sudden your whole caseload is going to be that specific group because you've been identified as a safe person. So it's a really positive thing. But unfortunately, in these marginalized groups, sometimes we can't just trust that because someone is licensed that they're going to provide the type of services that that person deserves and needs to be able to get happy and healthy and where they want to be in life. So the best advice that I have is to ask around, because word of mouth and knowing what providers, truly walk the walk, you're going to find out from our peers.
And then maybe one more question, Sydney, while we're on this particular topic. What could healthcare providers do? Is there a place where they can become more educated on some of these unique challenges that this particular community faces?
So when it comes to COVID specifically, I've seen so many emails going out about webinars, about trainings, and making sure that people are culturally competent enough to care for this population during this pandemic that nobody is prepared for. And I've logged on to a couple, and they are, they range in topics from mental health to physical health. So I guess just pop it into Google. Honestly, it's amazing what you can find through Google. I tell people as a social worker, that's like 50% of what my job is. I'm really good at it. So start to just, I can't think of any specific things off the top of my head, but I know that there are a lot of organizations that dedicate their work to this. So, sorry, I don't have it for you. Sheena popped up, so maybe she's going to give that to you. But the best thing that you can do is just listen. If somebody tells you that they want to use she, her, him, or he, him, they, them pronouns, just listen to them and to ask appropriate questions. If someone tells you that their orientation is pansexual and you don't know what that means, instead of just assuming, start that conversation with the person and let them know that you are interested in them as a whole person and that their identity is important to you as a provider.
And Sheena, you had some comments that you were going to make on this too. You guys do an awful lot of educating on this particular topic.
Yes, we actually do have an allyship training that is geared to folks in healthcare and situations, and also domestic violence centers and sexual assault centers, that will make it on the grounds more friendly, how to best do best practices, from making sure you have unisex bathrooms to the language in your materials, making sure they are accommodating to all folks of gender identity, and also expressing that you are freely educated as much as possible on the education of orientations and things of that nature. So you won't ask questions about a specific gender, as we have seen sometimes in the healthcare systems, or if you're going to any institution to get help. So it's making it more gender neutral, but also it's removing some stigmas that we have, once again, with institutions like the healthcare system.
Let me bring Lavelle into the conversation now too, because Lavelle, you are an advocate for the LGBTQ community, and you do a lot of education yourself. You also have personal experience with this yourself. Why is it difficult to find somebody in the healthcare system for people in this community? And what has your experience been?
Yeah, I would absolutely kind of just emphasize what Sheena and Sydney have already touched on, in part talking about resources not being available to people in the LGBT community, and it only being exacerbated when you break that down by race, ethnicity, language, HIV status, disability, and whatnot. And I think a major determinant to people not being able to get access to the things they need in healthcare is not knowing where they can go to be safe, to be heard, to be seen for who they are, and to get treatment and get resources that reflect the needs that they truly have and that will actually be useful for them and people in their community. So I think kind of what both Sydney and Sheena have laid out as ways to possibly kind of ameliorate some of those barriers are great suggestions to really start with and really help people in marginalized communities when it comes to getting access to those kinds of things. So yeah.
All right, thank you so much. And I want to bring Mary J in the conversation right now, because I know that the Toledo-Lucas County Health Department takes great pride in being LGBTQ accommodating and friendly and welcoming. And so talk a little bit about how you do that and let people know what kind of care they might be able to receive from the health department. Mary?
Sure. Well, first I just want to paint a mental picture. When you drive by the health department on Erie Street, what you're going to see on our electronic marquee board is that we're LGBTQ welcoming. And then as you walk up the walk to enter our front doors, you're going to see a huge rainbow flag hanging in our front window. All of our brochures, our posters, they all reflect diversity. Diversity about sexual orientation and gender identity. So that's the first thing that's going to hopefully welcome everybody into our building. We've done numerous trainings with our staff. So in fact, we had Nick Comives, who I know will be speaking a little bit later. He came in and did a presentation on language and how powerful language is. Right now, we are providing services. We're doing sexual health services, and we're offering PrEP. And for those of you in the audience who haven't heard about PrEP, PrEP is amazing. It's groundbreaking. It's an HIV prevention pill. So we are currently seeing patients on Mondays, Wednesdays, and Fridays by appointment. And I hope that everyone's experience is the best that it can be. And as Sydney mentioned about word of mouth, can we be better? Of course. But I think just seeing how our clientele within the LGBTQ community has grown, it tells me that we're doing a lot of things right. And hopefully we can improve on the things that we're not.
I want to talk just a little bit about maybe young people during this time, because we know that this can be a really difficult time for people who, you know, maybe don't get along with their families and are finding themselves in a situation where they are cooped up together and maybe not understanding each other. And Sheena, you spoke about this earlier last week when we had a brief news conference about this issue. But for young people, this can be a particularly confusing time where they just feel like they don't have anybody in their corner.
First, I'd like to say to the youth of the LGBT community, you know, thank you for doing what you have to do to survive and be safe. Right now, it's a lot of challenges. You may not have a welcoming home. You may not have that peer support or that support you find in schools or any other kind of like after school programs. So thank you for surviving. And we do have a lot of good community groups coming together to do virtual groups, to do virtual therapies. Equality Toledo will be sharing that on our Facebook page as well from surrounding Northwest Ohio agencies and Ohio agencies. And this is a very hard time for our youth. I mean, you know, in general, because if they're even are out, now you don't have a safe place. Sometimes more than likely, our LGBT youth are at higher risk for human trafficking, and also for coping with negative ways, as such as using tobacco or alcohol or drugs to cope with the feelings they have inside, which are valid feelings. So we just want to make sure we offer healthy coping ways, have someone to talk to, and we are here to talk if somebody needs to talk to us. We also have Trevor, which is a 24-hour hotline they can call or text. So it's some things out there. We just have to get the message out there to our youth that it's places for you still to be heard and seen during the COVID-19 epidemic.
I know in some cases too, there have been youth who, maybe leave home because it gets to be a pressure cooker situation that they just, don't want to be around anymore. And there aren't a whole lot of places for them to go in our community.
Yes, unfortunately, there's not, but I am very hopeful that our community is starting to recognize the need there. We do have safety net that does service LGBT youth and other youth as well that needs safe placing for a moment in time. And I know other partner agencies that in the LGBT community are looking to figure out how the best to house our youth and keep them safe during this time and after. So hopefully in the future, we'll see more spaces that are long-term living for them.
Let's bring Elijah into the conversation for a moment on this, because Elijah, I know it can be really overwhelming under normal circumstances, but under the current crisis situation that we're living under, stay-at-home orders, not being able to go out and maybe be in groups with people that you love and understand each other, can be really difficult. So what do you suggest as a mental health professional and counselor to young people in particular who might be feeling just lost and not supported right now?
I think that's a very good question. The crisis text line is a great resource for anyone in the community. It is there's virtual support. People can just text that, ask questions. There's trained people on the other end to respond and really provide support during this time. That line is available 24/7 all throughout the country, actually, and it's just a great resource. I think there are some things that we can youth especially can be proactive in doing, and doing especially during this time of stay-at-home orders, and not being able to see your friends, not being able to be around the people you're familiar with and trust and are supportive. Trying new activities, getting involved with things at home. There is some psychological benefit to being able to find a sense of control in your life. So even if it's just organizing your room, organizing your closet, just find a little bit of control in a world where there's a lot going on that we actually can't control. Can't control when we'll be allowed to go back outside and meet with our friends, or when schools start opening up again, or where the clubs we might have been involved with are starting back up again. Kind of find that that's something you can control. Also get involved in a hobby if you're able to, and you're not currently. There's I read one suggestion recently that said, like, start a new town in Animal Crossing. That's a game I see a lot of people playing, a lot of young people playing. I'm not too familiar with it, but just get involved in something new and different, and start kind of a new project or hobby that can bring some sense of satisfaction during this time.
And maybe just remind those young people and also people who support them during this time. Maybe you don't live with them, but maybe it's a niece or a nephew, you know, a friend of one of your kids that you have been close to, and how important it is just to maintain contact and reach out right now and what that means to people.
Yeah, you really hit the nail on the head with that, Chris. It is so important to find ways to stay connected with people during this time. And you can be kind of a light in someone else's life just by making a phone call, sending a text, letting someone you know, letting you're thinking about them, you're here to listen to them, you're here to support them, even reaching out, making that phone call of someone. It might have been a while since you've really connected with them. It could be a family member you're not too familiar with, or it's been a long time since you've seen them. Making that initial step to make contact, you know, social support is so very important to our own mental health and well-being, and we are by nature social creatures. So being able to FaceTime, being able to make those phone calls during this time is so important. Stay connected with people.
And I also think just to not be afraid to reach out, right? Because I think all of us under these circumstances are feeling those stresses and are a little more self-centered and self-focused, maybe just on our core families, because that's who we are, you know, confined with at this time.
Mm-hmm.
And so you may not just think as a friend or a loved one of somebody who might be going through something like that to pick up the phone.
Mm-hmm.
But also, if you are out there and you need that connection, don't be afraid to call people. They're not calling you. They're just kind of focused on their own things right now too, right?
Yeah, I think there is, a lot of us fall into this trap where we think that if someone isn't reaching out to us, then they don't really want to talk to us, or they don't want to be bothered by us. That is generally not the case. That's actually what our anxiety tells us. People don't want to hang out with us. They don't want to be bothered with us. They don't want to hear from us. So it's really important to work on overcoming that, make those connections, make those phone calls, even use, you know, Facebook Messenger. The Mental Health and Recovery Services Board is involved with kind of an Ohio initiative called Strive for 5, where we're encouraging people to reach out to 5 people on a regular basis. So even if you, one of the things I did was I went through my Facebook friends list, and if I hadn't heard from someone in a while, then I just reach out to them to see how they're doing during this time. It's, even if people don't engage very much, it sends a message that there's someone out there who cares, and someone out there who wants to listen, and that brings a lot of relief and a lot of feelings of warmth and acceptance that's good for our own mental health.
Yeah, and it might just be the thing that gets somebody through a day, right? And moves them forward in a positive way. And I think we forget how powerful that connection is, and how powerful reaching out and just letting somebody know that you're thinking of them and that you care about them is, right, especially during this time. Sydney, as a social worker, you also see a lot of this and talk with young people in this situation as well.
Yeah, I actually wanted to comment, kind of go on the opposite end and talk about a population that doesn't get, I guess, a lot of focus, and talk about our folks who are LGBT and aging. So I'm getting ready to do a presentation on it later this year. So I have a lot of this going on in my head right now, but the people who identify as LGBT and are aging, whatever you consider aging, 60, 65 plus, these folks have unique historical experiences that kind of shape the way that they're responding to what's happening right now. So some of my older patients that I work with, and like I said, I work with everyone who's living with HIV. So this specific person is an older gay man. And his story, I'm finding, is very similar to a lot of other people's stories who are similar to him, in the fact that when they grew up, it was a little bit more uncommon to be out and open about their identity. And so something like having children or expanding the family wasn't, I guess, as popular. So we see a lot of older LGBT folks who never had children, and so their family kind of stopped. I never really imagined that somebody would not have at least one person that they could count on. But some of the people that I work with that are LGBT and older, between just age in general and then the HIV epidemic in the 80s and 90s, they've lost a lot of their people. So I know that LGBT youth get a lot of focus, and I think that that's rightfully so. But don't forget the other end of the spectrum and those other populations that maybe, I guess, aren't as glamorous to talk about. And so, yeah, so just, if you have maybe older people in your life, just like the younger people, don't forget to reach out. I am someone who was raised by my grandparents, and so they have a special place in my heart. So, obviously I've been in touch with them, but if you haven't called grandma and grandpa in a while, if they're still alive or around, give them a call, especially, those people who might be a little bit more isolated.
Yeah, I think we tend to think of those folks as maybe better prepared for this, because a lot of them, my own mom doesn't really go out that much, so to her, this is kind of normal way of life for her, but it doesn't mean that they don't need those, touch-ins, and also maybe dropping off a meal to save them a trip, out to the grocery store or out to a restaurant to pick something up, so that they are protecting themselves, because we know that they are much more susceptible to this disease. And especially in our county, we know that about 80% of the deaths in Lucas County have been elderly folks. So we want to make sure that we're protecting them. I want to bring Nick Comides into the conversation on this issue too, because Nick, I know this is something that's near and dear to your heart as well, and that there are services in the city of Toledo that people can access if they find themselves in this particular age group and needing some of those services.
Yeah, absolutely. I mean, we've been working for some time now to start an organization or a chapter of an organization called SAGE locally. SAGE is an organization that's been along for a long time that sort of focuses on elderly LGBT folks and works to provide various services and connections throughout the community. So Equality Toledo, when I was with them previously, before I was elected to city council, we had been in communication with the area office on aging to really get that ball rolling. There's a great documentary on Netflix that just came out, and I unfortunately haven't had a chance to watch all of it, but my roommates watched it and talked about what it meant for them, and watching these two elderly lesbian couple who is searching for a place to live. They're looking for a nursing home to find that's going to be accommodating, and this is something that many people might not think about as an issue. Like, when you get older, you eventually you check in or make your way into a nursing home, and it's probably not a big deal, and you just look for one that fits your budget. But for LGBT folks or other marginalized groups, you might have to consider what discrimination has meant to you and what it could potentially look like. There's a lot of abuse in elder care facilities that we know about, and it's especially true for LGBT people, because the discrimination that we face in our everyday lives continues all the way until the end. And so you might be being taken care of by somebody who doesn't agree with your lifestyle as if it pertains to them. So the reality is that many elderly folks that are LGBT are in need of connection because they might not have a family that's present. Thanks for bringing that up, Sydney. They are less likely to seek services to get food, and food insecurity is a really big issue for elderly folks throughout our entire city. But if you're fearful of discrimination, then you're likely not going to reach out. If you're older and you need to seek medical attention, perhaps if you're LGBT, you might not seek a doctor out if you don't feel comfortable. So these are things that we're aware of and trying to mitigate in the future.
Nick, what would you say to folks who might be listening to this or watching it later or saying, yeah, that's me, I find myself in that situation? I know we have talked about the Area Office on Aging and the services that they provide for our community.
Yeah. I mean, I would say, because of that relationship that we've had with the Area Office on Aging, we've already been opening that door. I know that we've done some trainings at the Area Office on Aging already. So if you're LGBTQ identifying and you're looking in your, in your of the elderly population and you're looking for services, please don't hesitate to reach out to Area Office on Aging. They are a great resource in our community. I recently was there volunteering to pack about 1,000 food boxes that we had hand delivered to people's homes who requested them because they didn't have access to food. So I know that the Area Office on Aging is working hard, and I understand that for many of us that are LGBTQ, it can be a scary premise sometimes to consider reaching out. And one way that they might want to do it or might make it more comfortable is to reach out to an organization like Equality Toledo and get a hold of Sheena, because there's probably not a fiercer advocate to have on your side in this entire city than to have Sheena Barnes in your corner. So if you need to reach out to Equality Toledo and say that you're struggling with food insecurity, there's a food pantry that Equality Toledo operates. Perhaps they can get you food. But if it's something deeper with medical care or something, I know that the volunteers and the people that are involved with Equality Toledo would be more than happy to make those connections and to do their best to make sure that there's access to those services.
And then Elijah, if we could just bring you back into the conversation for a moment for this particular population as well. What are some of the things that you would suggest for our elderly population if they are feeling this isolation, and especially in the LGBTQ community?
So one thing I would suggest as a real tangible resource, other than what's already been listed, would be to contact the COVID-19 emotional support line. That is a line that is there just to hear people, provide support, be a warm person on the other end that you can talk to, share concerns, and feel like you've been heard. And they can offer some great advice for kind of how to cope with some of this stuff we're all experiencing, the fear, the anxiety, maybe even some anger about what's going on in the world right now. So that's one real tangible resource that I can think of right now.
It's a good one. Thank you. And no, we do have a lot of resources to share with you, and we will put those resources in the comments page, and we will show them all to you at the end of the forum here today. So get ready to take them down, or you can look in the comments section for that. Let's bring Sydney back, and then I also want to ask Mary J about this after we hear from Sydney. We know that people who have underlying conditions are more susceptible to COVID-19 than those who don't. So what about the community that is HIV positive, dealing with some of these immunodeficiency problems already? And how does that make them more at risk? What should they be doing to protect themselves during this crisis?
Sure. So I do just want to make a little announcement that I am a social worker. I'm not a doctor, I'm not a nurse, I'm not a medical assistant, I am a social worker. So I'm going to talk about what it's been my experience as being a mental health therapist during this time where our patients have had a lot of questions. So our patients are seen every 6 months for follow-ups. And so this happens across their whole life from diagnosis until death. So we get some pretty intense, close relationships with these clients. So they call us, if they have questions or they want to know what's going on with UTMC/MCO, which I'm not going to comment on, they call us. So for what it's been like for us is that we've had the very fortunate experience of saying that most of our patients are not really immunocompromised when we're looking at it from this perspective. Because for patients who are living with HIV and who are on effective antiretroviral treatment, so those would be the medications that they take to reduce the viral load in their body, and their medication is working and their counts look like how they're supposed to look, they're actually not at any increased risk than a person who's not living with HIV. So I think a lot of people kind of have this assumption that people living with HIV are immunocompromised, and there are some illnesses that they might be more susceptible to because of the way HIV impacts their body. But when it comes to COVID, if they're otherwise healthy, then they're not at an increased risk. But with that being said, we know that a lot of people living with HIV do identify as LGBT. And we know that people who are LGBT and who identify as LGBT are at a higher risk for having comorbidities like heart disease, stroke, cancer, and things like cancer, heart disease, lung diseases, and age, those are things that put people at an increased risk. So just because someone's living with HIV doesn't mean that they need to be more careful. But, someone who's living with asthma, like, myself, I'm someone who lives with asthma. Fortunately, mine's mild and controlled, but technically I would be at more of an increased risk than someone who's living without HIV and doesn't have one of those other underlying conditions.
And Mary, how about you at the health department? What are you guys seeing as far as people who are coming in and asking for help, and patients who might need some additional help during this COVID-19 crisis?
I was thinking about what some of the other guests on the panel said about isolation, and I had this epiphany. So for about 2 weeks, we were just doing telehealth, because we wanted to make sure if somebody was symptomatic with an STD, that we could at least kind of diagnose remotely and send them in the antibiotics that they needed. But a lot of my clients, they wanted to wait until we were actually seeing patients. And I think that says a lot about the services that we provide at the health department. They wanted a kind face. They wanted to go somewhere that was affirming. So they wanted to see our phlebotomist, our nurse practitioner, our nurse, because I'm really proud of our health department. I think we're a place that does feel warm and friendly. We're doing everything we can to protect the staff and anybody entering our building. So if somebody is HIV positive, but they've got a drip or a burn and it might be an STD, they might very well come seek services from us. Anybody entering our building has to wear a face covering. We take temperatures at the door. We are limiting our patients to one every 45 minutes. We're thoroughly disinfecting the room afterward. So if anybody wanted to come to the health department, you should feel safe and confident that we're doing everything that we can to take care of our clients and our staff.
And Lavelle, you were sharing with me earlier that you have had a great experience with the health department as well.
Oh yes, absolutely. When I got on the call, when we started at 6, I was so happy to see that Mary was going to be here too, because I love her so much, and love working with her and getting services from her at the health department. And absolutely, I can't speak highly enough of the health department. The way that I got access to PrEP there for myself was through word of mouth, through friends who were connected to Equality Toledo and other friends in the LGBT community here. in the city, and I've had nothing short of really great, positive, affirming experiences at the health department, from the staff who work at the front desk who are really patient and great at explaining things and how things work, to there's a really lovely older gentleman who draws my blood when I get tested. And to be quite honest, he's the person who's done the best blood draw for me. So I can't say how important that is to me as a trans woman who's been on hormones for a few years and had to get my blood drawn a lot for hormone replacement therapy. He is the best. Can't recommend that enough, which is really great. And just all the doctors and nurses who I interact with and talk to about sexual history and family health history and just the whole bit. Just everyone's great. And Mary is always kind and patient. And in fact, I think I owe her a text back for an appointment too. So I need to get to that on some point. But it's just been a really great place to get all different kinds of healthcare needs met. And I'm really grateful to my friends in the community for recommending the health department to me. So yeah.
Lavelle, what are the things that you find during this crisis and this stay-at-home order that are maybe challenges or barriers for you or for the folks that you are advocating on behalf of, that you're talking with every day? What are some of those challenges that you are seeing?
Definitely to emphasize what Sheena was saying earlier, in Sydney as well, about feelings of isolation and also for a lot of LGBTQ youth and elders as well, the feeling of being perhaps quarantined at home or isolating at home, either alone, which can exacerbate mental health issues of depression and anxiety, or what have you, but also for folks, particularly youth who might be at home with parents or family or guardians who are not accepting and not affirming. It can be an extremely huge mental and psychic confusing event to be away at college or grad school, or even kids who are in high school, and you're living your truth and you feel safe and you're out and you're living your life, and having your social and healthcare needs met as a queer or trans person met, and then to have to come home and quickly acclimate to not being able to be yourself in those ways anymore. It can be a really challenging thing to go through. So, and along with that, we also, again, has been circulating a lot through the news and through forums online, the numbers of abuse, of domestic violence, of sexual violence, and all these other forms of violence that are going on that were already existing before, but only got exacerbated by the conditions that we're now living under. So I think a big message I would kind of say to folks when it comes to the LGBT community is, you definitely, any kind of issues that we were already experiencing, any access or any violence or any oppression that was already going on, is only getting heightened and made more visible by being quarantined and by the pandemic going on. And so we really need to use this as an opportunity to pay attention to those barriers and get folks the things that they need, and maybe even make structural and institutional changes to make sure that we're better prepared for if this happens again.
And I think, one of the concerns also is just, we don't want people turning to alcohol and drugs, especially folks who are in recovery right now, right? Who have, done so well throughout the process. And now all of a sudden you find yourself facing some of these issues and challenges that you haven't faced before. So how do folks in recovery, and Sydney will talk to you about this, and then love to bring Elijah back into the conversation also to talk about folks in recovery and how that may play a part in this.
Did you have something you wanted to share before I start?
Oh no, go ahead.
Okay. So the reason that I got into social work and kind of landed in the job that I have now is for my passion that I have in supporting people who are living in recovery, or even those folks who are still, living in their active addiction and just doing the best that they can to survive. Our program takes a pretty pragmatic approach to drug and alcohol use. So we create a pretty, welcoming environment to talk about any recreational use that might be going on, or even, substance use. And so I guess something that I wanted to bring up and make sure everyone is aware of is that there is a ridiculously large resource list, I guess, for people who are living in recovery. One of the most important things for people who are sober or newly sober or have limited their drug use is the relationships that they make in recovery. And so basically we've taken these big groups of people that get together every Sunday at 1 o'clock for their 1 o'clock meeting. And now all of a sudden they don't have those relationships anymore. And so NA, AA, CA, Al-Anon, Smart Recovery, all the big recovery groups, they have online meetings. And they have online meetings basically on the hour, every hour. There are ones that are in Canada, they're all over the world. And so to just let your people in recovery know, or if you're a person living in recovery, that those resources that you're used to relying on for support, they're still out there. They just look a little bit different. And that also to remember that, if you are using substances to get by right now, that we understand that, but we also want you to protect yourself. And so the health department also has services through NOS, the Northwest Ohio Syringe Services Program that runs out of the health department, and they're able to provide safe injection supplies, fentanyl test strips. I know last weekend or the weekend before there was a surge in overdoses from opiates in the county. So, being able to access those safe injection supplies and those fentanyl test strips, if you are still someone who's using, or if you know someone who's using, to have those resources. Narcan too, I'm a big advocate for Narcan. So if you know people who use drugs, or if you work with people who use drugs, or you yourself are someone who uses opiates, consider getting Narcan. You can get it from the pharmacy. You can also order it online through Ohio Harm Reduction Coalition. You can get it through the health department. So there are a lot of ways to access those resources that can support people in recovery or save lives for people who maybe just aren't ready to enter that phase of recovery yet.
And Elijah, you guys deal with this a lot too in your everyday work. So, maybe you can just speak on this for a moment also and talk about the resources that are available through your board.
I think it's important to understand that this being in recovery is a process for a lot of people, and there are times when people relapse. During this time, it might not be appropriate for people to get into treatment, and that's fine. We want people to know that there are resources for when they are ready. Zeph Center, UTMC, and Arrowhead both offer inpatient detox where people can go and they can medically monitored for symptoms of withdrawal, and then be prescribed an appropriate medication to help with sobriety long term. There are all our treatment centers, the Mental Health and Recovery Services Board helps provide some funding to, are all operational. They are seeing clients a lot virtually. People can get into treatment as soon as probably tomorrow. We have the recovery helpline that's operational 24/7. That can help identify appropriate providers and make appointments to those providers that offer all types of medications that really help with the treatment for opiates and other issues like alcohol and stuff. So there are a lot of options out there. We like to refer people to the recovery helpline because it is a great service in our community that can just make an appointment with a provider within 24 hours.
And one of the great things that has happened is that, the states have really opened up those regulations so that you can do virtual visits with people during this time, because I know there was, doctors' offices are opening back up now slowly, but there are virtual visits that are available, and insurance is covering that now, correct?
So there's virtual visits, and then the state really relaxed the telehealth rules to allow like phone therapy straight by the phone. So you don't even have to have like a device with a camera that you can join a session with a therapist, you can just use your phone. There's also, generally, get into treatment, there has to be an assessment done, and that is done virtually. They're working on getting the paperwork to you, so you don't even have to come to the office at this time. And ongoing therapy, whether it be individual or group therapy, can be done virtually, and seeing the doctor can be done virtually. So there's lots of options, even in this stay at home. I don't want anybody to think that, someone, if they are ready for treatment, can't get treatment today. There are options.
And we're going to give you that phone number at the end of our forum so that you'll have a resource to reach out there. But as we've heard kind of talking about all of these different things, Sheena, I want to bring you back into the conversation because members of the LGBTQ community are not just LGBTQ. They are, ethnically diverse and hearing impaired. They may be recovering in that community as well. So there are a lot of other things that pieces and parts that they belong to as well.
Yeah, so one of the things that I really wanted to focus on as a director, the new director for Equality Toledo, was the intersectionality of us. And that includes the deaf community, that includes Latinos, Hispanics, that includes, African Americans, that includes so many different layers. And the thing that I am personally experiencing or seeing now is that with COVID-19 and things like Lavelle said that already was happening, it does intensify things. As a Black queer woman or LGBT woman, it is very like living in two worlds. So we have to see the administration attack healthcare for LGBT folks, but also we have to, as a Black woman, see another, unarmed Black male get killed and then get hit with another Black trans sister taken away from us. So it's so many different layers. I think a lot of the folks in the LGBT community experience, depending on your background, your race, your ethnicity, your class, your gender identity, your orientation, your age, as we pointed out. So many different layers in our community. That's what makes it beautiful. But I think that's also what makes it challenging right now during the COVID-19, because we have so many different layers to address. And I really wanted this moment to say for my family and friends, sisters and brothers of our LGBT community, we do like to partner with agencies and the community to make sure that you get seen and heard. And within the deaf community, I definitely want to take a moment to give a shout out to the Deaf Services of Northwest Ohio, because I couldn't even imagine right now trying to get all the information. Thank you to our translators that's on national, local, and state news translating for us. And thank you to the reporters who are taking time out to translate in different languages. And once again, it's kind of highlighting some of the things we should be working on. And hopefully we'll be changing and making sure it's more accessible with information and education, as well as making sure all people in the LGBT community and not in the LGBT community feel welcome. And I think that's one of the things that Equality Toledo is definitely going to keep working on.
And I know that things aren't perfect, but I do feel like we do have that basic welcoming attitude in the Toledo area. And do you feel that, Sheena, that we are a welcoming community?
We have an amazing LGBT community. We have amazing allies here. Even with the challenges of losing our safe spaces, the love that we have here, I feel my children feel welcome in their space. And we are resilient. Like I think any other group that have challenges, we are very resilient. Unfortunately, we won't be having pride that is normal like we used to, but we're still having pride because you can't take our pride. And so we're still gonna do it. And with that, I saw the beauty of our community once again that we're not stopping, we're not giving up, we're here. So I do see it here in Lucas County, the beauty of allyship, our community, and trying to get things right and make things better. It may not be where we want it, but I think we can do it.
Nick Comives, I would like your take on that same question too. Is Toledo a welcoming community, and what do we need to do to make it even better?
Yeah, it's a great question. Now that I'm on city council, we get to pass resolutions. We reaffirm constantly whenever there's an act that happens locally or some type of hate act that happens in a neighboring community or outside of Ohio even. Oftentimes we reaffirm our commitment to being welcoming and open. And I do think it plays out. For 5 years, I was in the role that Sheena is currently in at Equality Toledo. And we made really big strides to work on policies that were inclusive of LGBTQ people. Toledo, I love to talk about how the fact that Toledo was the first major city in the state of Ohio to pass non-discrimination protections that included LGBT folks. And so we have a long-standing history of being open, being welcoming. I have no doubt that will certainly continue. I saw it today. We just announced, as Sheena said, that Pride is being canceled this year, so we can make sure that we're all protected during this time and get to stay safe. But you can already see people rallying around what are alternative ways that we can support LGBT folks and still celebrate and acknowledge and recognize those folks throughout our community that are doing great things for LGBTQ people. So yeah, there's no doubt to me that Toledo and Lucas County will continue to be a welcoming place. I think it is certainly one of the reasons that we see people want to live in Toledo and why they move here. When I was at Equality Toledo, I would receive emails from people who were saying, I'm moving to Toledo from San Francisco. Is there even an LGBTQ population that exists in Toledo? And I would happily tell them yes. And we have a lovely mural that declares that love is love and Toledo loves love. And so, we have a wonderful music festival that is unfortunately also going to be canceled this summer that happens in front of that wall. I mean, we just always show love for people. And I think that when it comes down to it, that's ultimately what makes a community great, and also what is going to make this experience that we're all undertaking, whether or not you are a part of a marginalized community or not. I mean, we're all experiencing isolation, and the answer to a lot of our issues is love. And you hear that when you hear Elijah talk about reaching out to people that you might not have talked to on your Facebook, or to find 5 people and make sure you stay in contact with them. These are ways that we express love for each other and continue to show our support for one another. And I'm really proud to serve in a community that is centered on this idea that no matter who you love, no matter what you look like, no matter any of these other factors that oftentimes cause people to feel marginalized or be oppressed, are not things that we focus on here. We are focused on how do we make a community where all people are welcome, where all people have opportunity, where all people have access. And I'm grateful to my colleagues and to the people in this community that continue to make that a possibility for all of us.
Nick, as we reopen business and as we try to get things moving again, do you have any concerns that are specific to the LGBT community or community in general?
Yeah, I mean, this is something that always, frankly, concerns me. It's unfortunate that we hear of businesses or places that want to deny services to somebody just because they identify as LGBTQ. This is a problem that we've been plagued with in the past, and I'm sure that will continue to be an issue moving forward. I am a little bit concerned because we have seen some rollback of protections for LGBTQ people at the federal level under the Trump administration that have been occurring during COVID-19. And I'm just going to say it, but I'm not really sure that that's what we should be concerned about in this moment. I think people's safety and well-being is first, and we shouldn't be using this as an opportunity to be political or to roll things back and make people's lives more difficult. But the reality is that it is happening. And I'm a little bit concerned that, as we move forward, when places are reopening, are these types of ideas or concepts going to be pervasive, and are we going to see them as issues? I think that one of the great things, again, and to go back to maybe the last question, is that, we have worked really hard in this community to break down a lot of those barriers, to make sure that people can be paid fairly and equally for the work that they're doing. And that includes LGBT people. So, we will continue to do all that we can to provide safe workplaces, to provide safe places for people to engage in commerce and in our economy. And, I think that those of us that are elected officials that are LGBTQ and our allies, organizations like Equality Toledo will continue to be on the lookout and act when it's appropriate, because the reality is that, when something like this happens, we all realize that ultimately, down to our core, we are simply human beings, and something that we cannot see can drastically alter all of our lives in a matter of days, weeks, months, and completely change our way of living. And that none of these other characteristics that are really powerful and important and need to be embraced matter as much, because above all else, we need to make sure that we have shelter, access to healthcare, food when we need it, and so we will continue to look at those basic necessities and recognize our shared humanity, and hopefully that's a lesson that we're all going to be learning through this process.
Yeah, great. The great common denominator that we have, and I think a lot of us are thinking about things differently over these past few weeks. Nick, I'm going to put you on the spot and start with you, but I would like our other panelists to also be thinking of this before we share our resources. Just a final word or thought from each of you as we wind our conversation up. I'm not seeing any questions from our audience. So I will just ask you, Nick, if you have a message for the LGBTQ community members who may be watching, or for those of us who would like to be helpful at this time.
Yeah, my first message is that all of us, every single one of us, are under dire circumstances, right? I mean, our entire way of life has been uplifted or uprooted and changed. And for those of us that are LGBTQ, it can really be an added burden. Just the other day, I was sitting here with my partner, and I said, I really just kind of miss being in an atmosphere surrounded by other people like us, and what that means, what it feels like. We would be able to go to a place like George's to experience that, or have Pride or Love Fest that would normally be coming up, and we could see it in the future as a place of comfort, and to be around other people who have similar experiences, and how important that is, and I'm certainly missing that, and I'm missing my community, and I want to give hugs to everybody I see, and the reality is that has changed. And so the best that we can do is to reach out to one another, to check in with each other, to make sure that we know that we are loved and that we are in contact with those that we love. And I think the most important message is that I understand and feel very fortunate that I can be in a household with my partner and with two really close friends who we all live together, and it's commune style, and we're going back to the land, and we're planting a vegetable garden and composting, and it's wonderful and brilliant, but not everybody is fortunate enough to experience that. And I think that the comments that were made about being able to be open and be who you are when you're away at college, and now you're being forced to live at home where someone might not accept you, is a real danger to people's lives. And if you're listening to this and you're not LGBTQ, the first thing you can do is reach out to your friends that you know are LGBTQ and just check in on them. But if you're listening to it and you might be living with somebody who, you might want to consider easing off a little bit, taking a break, let people breathe, recognize that there's so much that's happening, that having to be pressed on about your sexuality and who you love or how you express your gender are so, that fight is so meaningless in this moment, and so purposeless, and serves only to serve yourself and not others. And I believe that life and love is about service to others. And so I would just hope that people are mindful and considerate of all people and their backgrounds at this time, and then certainly when we come out of this fight.
Yeah, putting yourself in the other person's shoes is really important during times of crisis, at all times, actually, to be able to try to understand where somebody else is coming from. Nick, thank you so much. Sydney Renner, if you would offer maybe a couple of last thoughts for our audience.
Yeah, I'm glad I got to go toward the beginning. So hopefully I still have some unique ideas. But as we were talking, there were two things that came up in my mind. And the first one is that if you have a problem or a need and you're not sure where to start, just start asking questions. There's everything from a mutual aid Toledo Facebook page where you can literally be like, I need $30 for my phone bill so I can talk to my kids. And other people in the community can help meet that need, all the way to, if you have an older person in your family and you want to call the area office on aging and see what type of services they have, now's the time to do it. For a lot of people, we have a lot more time than we know what to do with right now. And so if you have questions about, unemployment or case management or, getting on PrEP or getting health insurance, now's a great time to start reaching out. And being a licensed social worker, I would say, find a social worker in your life or at a local agency and see what needs they might be able to meet. Because there's all kinds of unique stuff floating around out there right now, from free internet if there's a kid in the house that's doing online education, or free cell phones if you're a recipient of Medicaid or SNAP benefits or other type of benefits through the Department of Job and Family Services. You actually qualify for a free cell phone every year that would have internet capability, so you would be able to meet with health providers or mental health providers or something similar to that. So basically that all boils down to, if you have a need, just start asking, and most likely someone in the area can meet that need. It's a really great and giving community. And then the second thing that I wanted to mention is that if you are watching this and you consider yourself an ally, the allyship is a verb. It's a descriptor, but it's also a verb. And so that means that if you see someone who's making negative comments or misgendering someone, or, using a dead name or something like that, and you have the capacity to step up, then do so. There's a lot of training through like the bystander intervention training that talks about how the person who's not in the marginalized community a lot of times has the most power and also has the most safety in the situation. And so instead of relying on the person who is marginalized to consistently stand up for themselves and to put themselves in danger potentially, be that ally and help that other person understand why their comments aren't helpful, or why you can't call the person she, even though you knew them as she for several years, and to take what you know about protecting the LGBT community and really put it into action.
Yeah, those are great points, Sydney. And, it's all about just being educated, right? So, and I think it's, the onus is on all of us to be able to educate ourselves about some of those things, and to not be afraid to ask our friends and family members who are members of the LGBTQ community, what do you prefer to be called, or can you explain this to me? Chances are they really would like the opportunity to talk about it and to be able to explain to you how that works and why, and give you a better understanding so that you know where they're coming from, and you can better address and be a better ally and supporter to them. All right, Mary J., are there any last thoughts or?
Yes. Chris, you have been an amazing moderator.
Thank you.
I'm just so humbled to be part of this panel with such kind, smart, compassionate people. But this is what I want to say to my community, which I'm a part of, If you've had a bad experience from a healthcare provider in the past, or maybe you're just afraid that your healthcare provider is not going to understand your unique needs, or you're just simply afraid that you're going to experience prejudice and discrimination because of the provider's own homophobia. If you have sexual health needs, if you are interested in PrEP, come to the Toledo-Lucas County Health Department, and we will do better. We will be better. Thank you so much.
Thank you, Mary. Appreciate that. And Elijah, would like to go to you right now. We are going to give several phone numbers and resources for folks to be able to access. You guys have really done an amazing job. That COVID emotional support line was a brilliant idea. And I know, a lot of people, as I said, in this situation are finding themselves under stress that they've never felt before because of the current situation.
That's exactly right, Chris. I think it's important that we recognize that people are under increased stress, fear, anxiety, feelings of insecurity, and that's normal, and it's okay to feel that way. Understand that this pandemic will end, and we as humans have a natural tendency to be resilient and to survive these type of things. So understand that this will end, and if stress and anxiety is just too much to handle right now, there's help available. By looking through the resources that you'll see in a little bit, there's help available. And that in the meantime, while we're all waiting for this to end and seeking our sense of control and sense of feeling safe, that it's just good practice to start noticing the good in things, that stuff is working out. We have great leaders in the city, the county, and in our state who are making sure that we're as safe as possible. And notice the good things that are going on.
Yeah, gratitude is always something that is very empowering when you think about the things that you have to be grateful for. And it also, research shows, can bring you more happiness in your life if you try to focus on those things. And sometimes they're hard to find. You really have to think about it. And, something as simple as a hot shower might be the thing that you're grateful for that day. But living in gratitude definitely is a help. Lavelle, what are your final thoughts or final, words for the folks that are watching this and what they should do during this time?
So I have three major things that I have to say on for our wrapping up here. And first is just to anyone watching, especially members of the LGBTQ community, especially members of our community who are Black or who are trans or genderqueer, non-binary, or HIV positive or disabled, and to anyone who's lost someone, a loved one or someone close to them because of the pandemic, I love you. I think that those are three really powerful words that could really help a lot of people right now, really help them to hear. And it's something that has been bringing me a lot of joy to say to my friends, my partners, my family, my colleagues. And it's something that I want to continue to kind of share with folks, is that love and that sense of solidarity and community and connection. And also, the only resource that I feel I really can offer is if you can see my name anywhere on the screen, that's my name on Facebook. And anyone who needs someone to reach out to someone to talk to, or needs some advice about something, wanting to connect, or honestly, just even to send a funny meme to, please feel free to reach out to me. I definitely would love to be someone that folks can reach out to, because we really need that sense of connection right now. Also, I wanted to mention, I am a doctoral student at the University of Michigan. I'm writing a dissertation in English and Women's Studies, and the particular work that I do is I research the ways that imagination inform the ways that Black trans women specifically resist violence and oppression in our culture. And doing that work, which has been very, very difficult given the circumstances of what's going on, all the pressures that academics are facing from universities, especially those who are teaching or not tenure track or what have you, is that I'm learning that imagining new ways of being, new ways of living, of surviving, of making it day by day, new ways of learning and growing and healing have been really, really difficult, but also generative for me and good for me. So for those who have the capacity to do that in their daily life, imagine new ways of doing things, new routines or new habits, I encourage you to do that. And hopefully that might be some benefit to some folks and help lighten up the load while we're still under quarantine. And then lastly, I wanted to say, I really love that Sydney mentioned that allyship is an action, it's a verb, which I definitely agree with. And I think just to tack onto that, I encourage folks who are allies or who are doing any kind of supportive work during the pandemic to center our most marginal in all that you do. Whether it's getting food for folks or any type of mutual aid or sharing of money or resources, whatever you're doing, make sure that you do your best to try to center those in our community who are most vulnerable and most impacted by the pandemic. That's where I think the real, really good work happens. So I'd like to leave everyone with that, and thanks for having me.
So great, and such a great reminder. And listen, there's not a lot that we can all feel really great about right now. You know, people are under stress, we're staying at home. And so being able to look outside yourself and seeing how you might be able to help someone else is really important and is a really great tool for all of us to use to be able to see the situation in a different way, but also to make a profound difference to somebody else who might really need it right now. Sheena Barnes, I'm going to let you have the very last word before we get to our resources, and just let folks know, I know you have a lot of resources available for folks and they can call you. We're going to give that number in just a moment. But just so important for people to feel like they have a place to reach out to and a place where they belong.
Yes, and first I'd like to say thank you to the health department, Toledo Health Department, the city of Toledo, for having this conversation and creating this platform with Equality Toledo. Thank you to City Council Member Nick Comize. Chris, you did a phenomenal job, thank you. And Elijah, Lavelle, and Sarah, you just gave the bread to the butter of this conversation. I know it's a difficult conversation to have right now when everybody's impacted. But we know that we have to keep up the good fight. And so those in our community, I love you, I see you. And like I said before, thank you for surviving. Just take it minute by minute. And if you can't, we have great numbers you can reach out to and folks that will be willing to walk you through whatever you're going through. And I really just want to say, yes, we're starting to do things now during this pandemic, but let's keep it going. Let's keep it going. And so reach out if you need services, and thank you to our DSCs interpreters for providing communication. Once again, in the marginalized groups, we thank you for doing that. And if you need anything, I'm at Equality Toledo, so let me know.
All right, and we have up here on the screen right now some of these resources we've been talking about. Affirmations is a place that is open Monday through Saturday, 9 to 9, 248. You can see the number there on the screen. Did we just lose it? Here we go back. Thank you, Shannon. Goaffirmations.org at 248-398-7105. The Trevor Project is thetrevorproject.org, 866-488-7386. That is a hotline that is open 24/7 to take your calls and answer questions or concerns. We also have some local phone numbers for you to use as well. And I'm just gonna go with the flow here. Equality Toledo is our first one, and you can reach Equality Toledo at 419-407-6225. info@equalitytoledo.org is the email, or equalitytoledo.org is the website you can look to for all of their resources and services. United Way 211 is also very friendly, and they are providing a variety of services right now. If you are food insecure, if you need food, if you need other services, if United Way can't help you themselves, they can direct you to the folks who can help you. So please don't hesitate to call 211 on your phone, or go to unitedwaytoledo.org. They're a great organization, a great clearinghouse. As Nick mentioned, the Area Office on Aging, which is areaofficeonaging.com at 419-382-0624. They also can help with various services for our elderly and senior population. Or if you have a loved one who is a senior and needs some help, you will be able to get some services through there. And I think there is one more. Do we have the mental health numbers to give you as well? This is a really amazing number, this COVID-19 emotional support line, something that was set up by the board specifically for folks who are under stress right now, at 419-442-0580. If you just need someone to talk to, you're just stressed, this is a great phone number for you to call and just get some help. Also, the crisis hotline, 419-255-3125. If you are feeling really kind of desperate or in a serious situation, this is a great phone number for you to be able to call and access. Supporting local heroes is for folks who are serving on the front line, 419-841-6781. They are giving free health services to those folks who are working in healthcare, law enforcement, or other ways on the front line. And the ZEP Center has a variety of resources as well, including recovery services at 419-841-7701. All of those numbers will be put in the comments section of the live feed after we are finished broadcasting. And I think that's it. Is that it, Shannon? I'm pretty sure. Okay, so if I could have all of our participants please turn their cameras back on for one last goodbye. I just want to thank all of our panel members here for being so terrific and so open, for providing all these wonderful resources. And we want the folks who are watching out there to know you are not alone. All of these great folks and so many others in our community are here to help, are here to provide you resources, and are here to be able to answer the phone if you use one of those phone numbers and need somebody to pick up on the other end. We don't want you to feel like you're out there alone during this time. All right, thanks. I've never been prouder of our community. I feel like this is a time where, you know, in times of crisis, you see what people are made of, and you're seeing that Toledo is made of some pretty great people right here during this forum. So thanks to all of you, and thanks for being with us tonight. Good night, everybody.
Good night. Thank you.